Harrison Crowley, please. Nice to meet you.
Hey, how are you?
I'm Dr. King. Can you please come to my office? So what brings you in today?
Well, Doc, it's a bit embarrassing, but I think there's something wrong with my waterworks.
In what way?
Well, I've noticed that when I wee, I seem to start and stop with my stream, and it's getting slower. I'm also getting more of an urge to wee more often, and it's waking me up at night.
That's interesting. Can I ask you if you have any family history of prostate cancer?
Yes, my dad died of it, and my brother has just been diagnosed with prostate cancer.
Damage or change in the genetic material of cells by environmental or internal factors sometimes result in cells that do not die and continue to multiply until a mass of cancer cells or a tumor develops. Prostate cancer is this process occurring in the prostate gland. Prostate cancer usually occurs in the peripheral zone and usually occurs in more than one site within the prostate. While the cancer is confined to the prostate, it is called localized. Prostate cancers vary greatly in their aggressiveness, and some may never cause any health problems. Others, when left untreated, may grow outside of the prostate and travel to lymph glands and through the circulatory system to other organs. These secondary deposits are called metastasis. Even aggressive prostate cancers are usually slow-growing and may take years to cause problems.
It's also a difficult cancer to manage because we don't know whether the cancer is life-threatening or aggressive, and it may spread to other areas like a process called metastasis. Or it will be benign, which means you can live the rest of your life with it and die of something completely unrelated.
Well, what do I have to do to find out if I have prostate cancer?
The first step is for me to perform a digital rectal examination. That involves me putting a lubricated gloved finger up your bottom to physically feel your prostate gland. Are you okay if we perform that today?
Well, I prefer not to, but if you think it's a good idea, I'm in your hands, Doc.
Just relax, this will only take a second.
Oh!
Yes, I can feel a hard nodule on the edge of your prostate here. So I highly recommend that we take a blood test. This will test for your PSA levels. If your PSA levels are high, then we can discuss further options from there. Your PSA test has come back and the levels are slightly raised. So what I want to do is retest you again in 6 months and look to see how rapidly the PSA is changing. This is called active surveillance. If the velocity of change is high, then we may need to refer you on to an urologist for further inspection. Thanks for coming back in. These are your test results from the last 6 months. Your last PSA test showed quite a dramatic increase, from 1.2 to now 6.1 nanograms per millimole. That's a high velocity change. In my opinion, we should now refer you for a multi-parametric MRI scan, which will show the prostate in more detail, and I will also refer you to Dr. DB, who is a urologist, who will conduct a prostate biopsy.
Okay, thanks, Doc.
The MRI allowed us to accurately biopsy your prostate. I've sent it away to the lab and they've been able to report on the tissue. You have a high-grade prostate cancer. In my opinion, you are a prime candidate for robotic surgery. But we can also manage this with radiation and/or hormone therapy. I will be referring your case to our multidisciplinary team, which will include a radiation oncologist and a medical oncologist. Your case is completely unique to you, therefore the way we decide to treat it will be individualized for you. I recommend surgery. However, there is a chance that it could leave you with incontinence and erectile dysfunction. These can be long-term problems, although physiotherapy may help you to improve both of these in the long term. These are your options, but the final choice will be yours.
Alright, thanks, Doc.